Now that our cases are increasing, what do you think about the government's reopening of parts of the economy and talks about reopening the airports?
For me, I think I will even ask for the government if we can have 6 to 6 rather than 9 to 5. 6 to 6, because 9 p.m. what people do is, well, it gives us enough time to hang around with friends and drink up to 8:30 and then go home. No, if it's 6 from office, you are going home. So I think we need to consider that. Like I said, I would go for some level of lockdown, about 2 weeks to a month. But I'm glad that the president said up to mid-September. That is good enough. If we have good enforcement, mask wearing, transportation is limited to 50% rather than 75%, so that it's easier to monitor. I have a vehicle that takes 5 people. When you ask me, 75%, 3 or 4. But if you tell me it's 50%, I know it's 2.5 persons in my Jeep. That means that I cannot take 3 persons. So it's easier to monitor. So simple things like that, if we're able to adopt those simple things, I think that will go a long way. When we are reopening something or decreasing the measures in health, and I'm just going to be talking about health. In health, we are guided by 3 things. 1, when we have that, is that reopening really very, very necessary? And the answer for say the airport, yes, it's necessary. 2, is that reopening risky? In my view, it is fairly risky because after all, our very first case was an imported case. However, since that time, all the cases that we've had have been internal. We are not too sure about the cross-border events and how many have led to cases. But the 1,000 or so cases that we have all been internal. They have not been imported. So the risk is sometimes overblown. My challenge is when we have a lot of flights, how we'll be able to monitor the hundreds of persons that enter, and how we'll be able to monitor them so well that if any is positive, we are able to catch almost immediately. I like the idea that the president gave yesterday that we should be exploring the possibility of having a type of test that can be done at the airport upon arrival. 1, you must have a PCR done before you get on the plane. But once you get here, we also test you at the airport. And if you are positive, you go back. Or if you are positive, we put you in isolation. So that will control that. Now, the other thing that we think about before opening up a measure. So the first one I said, is it necessary? And the answer is yes. Is it risky? And for the airport, I think it's a medium risk. And the third, for us, which is the most important, is if we open the airport and we have effects coming from that opening, is our health system robust enough to withstand that effect? And the answer for me now is no, because we cannot have enough places to put our isolation cases. Therefore, we cannot. And I was very happy yesterday when the president, did say. I was very happy when the president yesterday did say that he is not in support of opening the airport till at least a point in time. And I think he had mentioned mid-September, which is very good, because why? Between now and mid-September, this week, we are receiving some ventilators. The health systems will have to be equipped enough so that if we have something untoward as a result of opening the airports, at least the health system will be able to deal with that.